My dad had schizophrenia, and growing up, we didn't talk about it. I knew that he was very eccentric and at times very ill. He had a lot of paranoia, and it wasn't until very, very late in his life that he got a diagnosis, and unfortunately he passed away because of the illness just almost 3 years ago. I think the biggest thing, to be honest, that has changed is the reduction in stigma. So we as a family couldn't even name that he had an illness, and I don't think that he had the openness. The society wasn't open enough, the healthcare system wasn't open enough for him to be able to really talk about the symptoms that he was experiencing, and now that the stigma has reduced, I think that it's much more, it's still very challenging to come forward and ask for help, but I think that healthcare providers, the doctors, nurses, police, society in general, I think are much more able to handle the behaviors that come along with a serious mental illness like schizophrenia. And so I think that's been the biggest change, really, is the decrease in stigma. There has not been adequate investment in actual healthcare services and supports. And so what's happening now is that more people are asking for help, which is a great thing. We want people to ask for help, but we also want the services to be there when they do.